All right. So we are going to now do AP supine abdomen. You're going to find that there's a lot of variations on how you position for this one, but I'm just going to stick with, for starters, on step-by-step how the book is going to explain it, okay? So on a standard KUB, so when I say KUB, you find unfortunately there's a lot of different names for this too, so you can see it says KUB right here too.
Kidney, urethra,
urinary bladder.
Bladder.
So that's what
Kidney,
we have to make
urinary
sure that we
bladder.
include. So you can see that the patient is laying supine on their back on the table there. We've got 40-inch SID now. So we have been working with 72 for chest x-rays. Now abdomens are always done at 40. Okay, that's going to be the routine.
Abdomen's at 40?
Yes.
SID?
Yep. We're still going to use the largest image receptor that we have, so 14 by 17.
14 by 17.
And we're going to practice starting off with just doing a lengthwise field of view for everybody, okay? You'll find sometimes in the clinical setting that they might do two crosswise, too, like on larger patients. Sometimes it's just the routine because some sites, they require that we have a little bit more of the abdomen on than what the textbook talks about, okay? But again, for consistency in here, we're just going to do one lengthwise. And then you can see that we want to make sure that the patient is positioned supine and that they're going to be nice and straight. The arms are going to be placed at the patient's sides, away from their body, and the legs are extended. You can put a sponge underneath their knees. Sometimes that's more comfortable for patients. That's up to you. Excuse me. And then the heart position. So we're going to center the IR to the level of the iliac crest. So iliac crest, see the very top of the pelvis. Here is the iliac crest. So if you just put your hands on top of your hips there, that's going to be the iliac crest. So that's where we want to center our image receptor and centering our field of view, or the laser, in other words. It's going to be right at the crest. Okay? That's our guideline. But then from there, we have to make sure that we're going to get all of the anatomy on. So then we would check to make sure that we have it low enough to include the bottom of the pelvis. You see how you can see that right here? And then you also need to include both of the kidneys. Kind of hard to see here, but you can see the left kidney a little better. You see this shadow that I'm circling?
Yes.
Around there? That's the left kidney. And we will take an x-ray of Rex, and he does have kidneys, so we'll be able to see those once we take an image. Okay?
So where would you see that crosswise though?
Well, on the upper one you would. So if you did crosswise, you'd center one up here for the kidneys, and then one lower just for the, yep, then you have to take two, and one just for the pelvis. Okay? So we need, that bone down here is called the symphysis pubis, at the pelvis there, all the way to the top of the kidneys is what our criteria is. You can see that we're centered right down the middle of the patient, so right on the spine, so we've got even amount of anatomy side to side. Okay? So what we need to do is get our room all set up first. So first thing we want to do is go to our control panel. Okay? So you're going to want to
First thing to do,
abdomen.
go to control panel and select abdomen.
We did just have chest. You could either close as if we're starting with a new patient, or we could just say we're going to add an exam on to the current patient. So if you want to just add an exam on, you just go to select protocols, and then abdomen. And we can go, why don't we select abdomen series, because that's going to have everything in there. Okay, yep, accept. And then you have to open up that folder. See, even there's a chest in that folder too. So we're going to find AP abdomen. See, there's two different ones, AP erect, so that's going to be standing at the wall, Bucky. When it's just AP abdomen, this is going to be the most common abdomen x-ray, so if you just get an order for a one view abdomen, it means laying down. If it's a two view, then one laying down and one standing up. Okay? So, now we're going to make sure everything is set up correctly. So you can see that it went to the table Bucky. That's where we want it. And our KV range is much lower for abdomens now. So 80 is average setting. And then it does have all three of the AEC selectors turned on. Okay? Some units might just have the center one turned on for an abdomen. So you just want to make sure that whatever the default is, that's what's working well with your equipment. Okay? So that's all set. So we can go ahead and get our room set up.
Do you like play with any of those controls, or are we just going to select?
What I'm going to have you do is you're going to be writing techniques in those technique charts, and then you're going to be able to refer to that. So if we ever need to make any changes, that's going to be how you'll double check that. And so you'll always get that out when you set your technique. Okay? So far we've only practiced detenting to the wall Bucky. Now we're going to detent to the table Bucky. So you can see we want our tube in this orientation because that's where our image receptor is, right? Now we want to lock it in place to center it to the table. So that's still our transverse lock. Just like we were locking it inside the side here, now I'm going to do that with the table. Okay? Okay, so I'm just going to take the pink button only, and I'm going to turn my detents on, and I'm going to bring it over, and just like the wall Bucky, is locked in place for me. That light came on. Okay, now I need to bring it to 40 inches. I can see I'm at 32 right now. Now, before to get our SID at the wall Bucky, we were using that green button. Now I need to use a vertical. Yep. So now that vertical makes more sense in this orientation. It is pointing up and down, where at the wall Bucky it doesn't look right. So I'm going to bring this up to 40. And it does lock in place for you. Again, I've got my green light turned on, and it says 40 inches there. Okay? Now what I need to do, and we would normally do this before our patient is even on the table, okay? And so I wouldn't always center to my image receptor until I have the patient on the table. And the reason for that is because we want the table centered over the base, which it pretty much is right now. So in other words, I wouldn't want it like that, okay? Because the abdomen's about in the middle here. So I want, once the patient lays down, I want them centered under that. So I'm going to center my table. And again, we're going to assume the patient isn't on the table right now. And then I want to lower this down. It's tracking the distance. And then I would recommend that we just bring this down to the foot end of the table. Because now when you bring your patient in, the table's at a comfortable height for them. They can sit down and lay down, and you don't have to worry about them hitting their head on the tube. Okay? Alright, so now we've got our room set up as much as possible. So we would bring our patient in and ask them, after we verified their name and date of birth, got patient history, we would just ask them to lay flat on their back. And then the first thing you're going to want to do is get this table height at a comfortable working height for you. Okay? So remember, it's just double clicking, because you want to save your back. You don't want to be bending over too much, because you're going to end up hurting your back eventually. Okay? So that's up all the way. That's probably where you want it to be. And again, this has that auto tracking feature, so the Bucky's going to move with the tube. But I'm going to turn that up, because a lot of you won't have that option, okay? So I'm just going to move my Bucky, and I'm going to estimate about centering in about over the abdomen, okay? Now, I can only go up so high, though. So remember, the table floats, so we're going to end up moving the table. And And then I'm going to line up the center of my field of view to my image receptor. So now I'm just going to use that green button to move it longitudinally and center to my image receptor. You just see I've just lined it up with the laser there. Okay? So I'm centered, my tube and my image receptor, and I'm detented in. Okay? Now I'm going to position my patient. So the table floats, so you want to move the table to position your patient now. Once you lock in, or once you're centered with your tube and your image receptor, try to get in the habit. Don't touch it again now, because a lot of times what I'll see is, well, I need the field of view up here, so I see people starting to move the tube to position over the patient. Then they forget they're not lined up with the bucky, and your image isn't going to turn out. So center it all, and now float your bucky. So I'm just going to make sure that I've got the right field of view. Remember, we use the full 14 by 17, and now I'm going to position my patient. So double click. And I guess what I should mention too, probably before I even start centering on my patient, is I want to make sure that they're laying flat and straight on the table. So yep, by standing at the head or at the foot end of the patient, I want to make sure, do they look like they're laying straight right now? Or, let's imagine that they look. See how they're angled like that? You want to make sure that they're nice and straight. So when they're on a pad or on a sheet or a slider board, you can move the patient, just tell them what they're doing. If they're not, you may want to instruct the patient. Okay? So I would just be saying, I'm just going to be straightening you out a little bit. Okay? So you just are looking to make sure that the shoulders and the hips are square, that they're lined up. You can't really do that off from the side. It's really hard to tell if they're lined up or not. So once they're lined up, you can position from either side, whatever you're comfortable with. Now you want to center, so remember this line right here is going to be at what level on your patient? Yep, right at the iliac crest. So, unfortunately, that's not a palpable point on our phantom, but it will be on our patient. So, I'm just going to bring the gown up a little bit to look at the top of the pelvis. But you will be able to practice this on each other. And I can see that the top of the crest is right about here. See how that wing goes up? That's about the top of the crest. So that's where I'm going to bring that vertical line. Okay. Okay. The next thing I want to do now is center this line right to the middle of my patient. So Leah, you probably have the best view there. You can probably see that we're off center right now. Okay? So you want this to be right on the patient's spine. So you're just going to float the table. Just be careful once you've set the position head to toe. The table will float in all directions now. So just try and keep that where you want it to be. Okay. How does that look? Is that
Pretty
centered?
good. Maybe just slightly that way, but
A little bit more towards me?
no,
The other way? Okay. See?
That's perfect.
So I can kind of get it in the range off to the side, but you can't really tell until you're up at the head or the foot end. So you always want to do both. Try, you have to start by positioning off to the side, but then double check. Okay? So I need to have on the bottom of the pelvis all the way up, and I need to have the kidneys on as well. Okay? So there's a couple ways that you can make sure that you have the pelvis on, or the bottom of the pelvis on. If you're comfortable with it, you can talk to your patient. The pubic symphysis is palpable. Okay, so that's the very bottom of the pelvis. So I would never palpate like this on a patient. You want to do this instead, and just tell them, I'm just feeling for the bottom of your pelvis. Okay, and it'll go from the soft tissue of their belly to where you will feel the pelvic bone, okay? I understand if you're not comfortable with that. I don't expect you to do that. Another option is to feel for the greater trochanter. So if you feel for your hips, there should be a bone, and if you turn your toes in and out, you'll feel that bone move in and out. Can you feel that? And I can help you with that too, once we position on each other. If you draw a straight line across, what you're feeling is the greater trochanter of your hip. That's lined up with the pubic bone. So if you just feel on the patient's side, and I even tell them, roll your hip in and out for me so you can feel the greater trochanter, then you just want to make sure that the bottom of the image receptor is going to include that. So for some people, you'll be able to tell by the light field. That's going to work better for smaller patients, but on larger patients, as they get closer to, I'm going to just do something here so you can see how the field of view is going to change. Let's see how this will work. So the field of view can be kind of deceiving. So see how it looks like this right on top of the patient, but on somebody that has a bigger abdomen, watch how the field of view is going to get smaller.
Oh yeah, because you're getting closer.
See that? So it's deceiving. We can use that for positioning, but it's going to look small on some patients. So what you're going to want to do then is when you're checking to make sure that you're going to have everything on, pull out that bucky tray and look at the bottom of the IR here and line up to the greater trochanter. Okay?
Okay. So she said you can line this up here to the greater trochanter.
The bottom of the image receptor should be at the same level as the pubic symphysis and the greater trochanter.
Gotcha.
Okay? See, I'm still centered here. I was just floating the table around. And now we have to still mark our image. Depending on the equipment that you're using, you can either mark it right on the detector or table or the patient. So you've got options here. In this room, and for those of you that are working with a digital detector like we have, they're thicker than what the CR plates are, and we aren't really able to do this because once I push the bucky tray in, a lot of times the marker is going to get caught and it's going to move it or push it off the image receptor. So if you're working with a digital detector like this, you're going to want to place it, if you can see a little bit of light field, we want to mark down by the hip for abdomens. You can place it just a little bit underneath the hip. If you're not comfortable with that because you don't know for sure if it's going to show up, I don't mind if you place it right on the patient. Just never want to place it the tape directly on their skin. So when I've just got it on the outside of the gown, that's fine. Okay? So we can just practice with placing it right on the patient. Okay? We can't shield for abdomens because we need this area on, okay? So if I put a lead shield on over reproductive organs, it's going to show up in my x-ray. So we're not going to shield. Okay? So I'm going to, actually, why don't I just have you all work together before we take an x-ray? I'm going to just, and then I'm going to have you each practice detenting when we partner up in a minute. Okay, so for right now though, just practice floating the table and positioning for a KUB. And then we'll take